Why do some people have constant stomach pain, but doctors can't find any serious problems? Is it possible to restore gut health without heavy medications? How can you tell if parasites aren't the issue and something else is? And what role do emotions and lifestyle play in digestive health? In this video, we'll explore what causes and how to recognize conditions like chronic colitis, ulcerative colitis, and irritable bowel syndrome. We'll talk about the real-life factors that often turn out to be key, but rarely get discussed. Most importantly, we'll ask, is it possible to feel better without relying on medications that affect the whole body? Let's dive in. So what exactly is colitis? Doctors use this term when they find inflammation in the large intestine, that's the lower part of the gut. This inflammation can affect the lining, cause cramps, pain, bloating, and change your bowel habits, from frequent stools to constipation. In some cases, people notice mucus or even blood in their stool. Ulcerative colitis is a more serious condition. It's not just inflammation, the gut lining gets damaged. Ulcers form, and they may bleed. This usually affects the rectum or sigmoid colon, but can spread further. It needs close monitoring and an accurate diagnosis because it can impact your overall health, causing fatigue and weight loss. Irritable bowel syndrome, or IBS, is a different story. This isn't about inflammation. It's a problem with how the gut functions, even though everything looks normal under a microscope. The tissues appear healthy, but people still feel pain, heaviness, and irregular bowel movements, like constipation, diarrhea, or both. Some people feel like their bowels don't empty completely. Gas and stomach rumbling are also common. Lab tests and scans might show nothing unusual. The tricky part is that many symptoms overlap, which makes things confusing. Sometimes one person will get different diagnoses from different doctors, and that makes treatment harder. People try the usual medications, antispasmodics, laxatives, antidiarrheals, but without understanding the real cause, any relief is often temporary. Could parasites be to blame? Some people think so. There's a belief that intestinal worms or infections might cause inflammation and similar symptoms. In certain cases, that's possible, but doctors say parasites are responsible in only 7 to 8% of cases, so while it can happen, it's not common. Still, if you suspect it, you can start with a basic blood test. One indicator is the level of eosinophils, a type of white blood cell. If they're elevated, it could point to parasites or another type of infection. But you should always discuss those results with a doctor. One test isn't enough to draw conclusions. So if it's not parasites, what's usually behind these symptoms? In most cases, food intolerance plays a major role. The body might struggle to digest certain foods, for example, lactose, the sugar in milk. Even adults who used to handle dairy just fine may develop a partial intolerance over time. In such cases, removing milk products for a week may help you figure out if they're part of the problem. There's also gluten sensitivity, a reaction to the protein found in wheat, rye, and barley. Not everyone has an issue with it, but in some people, gluten can trigger inflammation or disrupt gut function, even without full-blown celiac disease. That said, starting a gluten-free diet without medical advice isn't a good idea. It's strict, and lacking fiber or other nutrients can do more harm than good. Always talk to your doctor first. Another common factor is antibiotics. These drugs can throw off the balance of bacteria in your gut, especially if taken repeatedly or without proper support. And let's not forget about stress. The gut-brain connection is real and often underestimated. When stress is high or long-lasting, it can change gut movement, sensitivity, and even the makeup of your gut bacteria. Some people notice that their symptoms flare up during times of emotional distress, major life changes, or conflict.
If you've ever had a knot in your stomach before a big event or gut pain during stress, your nervous system might be playing a big role in your symptoms. The gut reacts directly to signals from the brain. When we feel anxious, tense, or scared, the muscles in the gut wall can tense up too. This can lead to cramping, irregular movements, a feeling of pressure, or even pain. Sometimes we blame food, but the real trigger starts in the mind. Scientists are studying this gut-emotion link more and more.
Have you ever noticed a connection between stress and your digestive issues? Share your experience in the comments. It might help someone else see their symptoms in a new light. Now let's talk about ways to support the gut. Sometimes relief comes from simple and accessible tools. One common option is enterosorbents. These act like a sponge. They bind to toxins and help gently clean the intestines. They're usually taken for short periods, no more than 3 days, but even short-term use should be discussed with your doctor, especially if you have chronic conditions or take other medications. Some people find relief with herbal remedies. For example, chamomile tea is known for its mild anti-inflammatory effects, and lemon balm can help calm the nerves. Relaxing the nervous system may reduce gut spasms and discomfort. If your symptoms improve after a course of herbal teas, that could be a sign that stress is playing a part. Some people also use alder cone decoctions in practice. But again, it's best to check with a healthcare provider to make sure it's safe for you. Let's also mention breathing. At first, this might not seem connected to the gut, but regular breathing exercises can support the autonomic nervous system, which controls many gut functions, from muscle contractions to blood flow. Breathing techniques help regulate your rhythm, lower stress, and improve circulation. Some studies show they work as well as medication for IBS. If you're curious, we can make a separate video explaining these techniques in more detail. Now on to medications. Sometimes doctors use peppermint oil capsules. These act on the gut wall receptors, reducing sensitivity. This may ease pain and improve movement. In some countries, antispasmodics or even antidepressants are used, especially if anxiety or mood swings are present. There are also medications that regulate bile acid metabolism, which helps with digestion and soothes the gut lining. All of these require a tailored approach. They must be prescribed by your doctor. Never self-medicate. It's not just risky, it can make things worse. You might also be curious about a newer but increasingly discussed option, microbiota transplant. This involves transferring healthy gut bacteria from a donor. It's used in severe cases of gut imbalance. It's not yet a standard treatment, but some countries already use it. What do you think of this approach? Let us know in the comments. Let's also talk about probiotics, supplements containing live bacteria. They help some people while others notice no change. Research is ongoing. But even with these seemingly harmless products, it's smart to check with a doctor. That's not just for safety, it also helps choose the right type and dosage. And finally, let's talk about mealtime habits. When dealing with gut problems, it's not just about what's on your plate, but how you eat. If you eat in a rush, while walking, stressed out, or watching the news, even healthy food can make symptoms worse. Try to create a calm atmosphere. Set aside time and focus on eating. Avoid overeating. This isn't a cure-all, but it can be an important part of healing. If you've dealt with similar symptoms, let us know what worked for you. Personal stories can be a source of hope and helpful ideas for others. Share this video with someone who's struggling with chronic gut issues. Like and subscribe so you don't miss future videos. And leave your questions in the comments. We read them and often create content based on what matters most to you. Take care and stay healthy.